Right, good afternoon. Thank you so much for joining us this afternoon to talk about our three-year strategy for involvement and engagement of people and communities. My name is Sam Roberts. I'm the Chief Exec of NICE, and we're joined by members of the NICE team, as well as some kind of voluntary community sector and patient experts who are going to be talking to you today. So I'm going to give a little intro, then we'll get into some of the meat about what's in the strategy for involvement and engagement, and then we'll go to question and answers and then close. So just so that you know, we will try to get to as many question and answers as we can. Could you start to pop them in the chat as the thought kind of comes to you? So you put them in the Q&A bar that is just at the bottom of your screen. And we'll get the assembled folks to answer those. Everything is being recorded. And so for anybody who has registered to this event, we will send you both the slides and the recording in the next couple of days. And we will also make the recording available on our YouTube channel, the NICE YouTube channel, by the end of the week. So you don't have to write everything down. You will have kind of lots of sources of it for posterity. So maybe before we get into the meat of this, just to say thank you so much for joining. And this is a really exciting moment, I think, for both Claire and myself and other members of the board, in that, as you know, we've been thinking a lot about NICE, about what our future is. We know that health and care is changing. We know that patients, people, and communities are becoming much more involved and empowered in terms of their decision making. We know that the nature of innovation is changing. So we're thinking at NICE about, right, we've got to prepare ourselves for this future. And as we prepare ourselves, one of the things we absolutely need to hold dear is that the way we change reflects what society prefers, and that we involve people and communities in every step of the journey. And so this kind of strategy for involvement and engagement lays out a little bit how we're going to do that. Now, as some of you will know, I'm relatively new to NICE, only 2 years out of its proud 25-year history. And so as we go forward, one of the things we need to do is both protect what's been great about NICE's involvement and engagement of people and communities up to now, and build some additional strengths. So this is not at all about throwing the baby out with the bathwater. It's about saying, let's keep and protect the things that are good and build some additional strengths for the future. So without further ado, I'm going to hand over to Claire to get a little bit more into the nuts and bolts of the strategy, and then really looking forward to your questions and comments. Thank you.
Thanks, Sam. Hi, everybody. I'm Claire Morgan. I'm Director of Implementation and Partnerships at NICE, and it's a real honour to be here today, talk to you with the team and some of our partners that we've been working really, really closely to bring you this draft of a new 3-year strategy for involvement and engagement. It's a real milestone for us, as Sam has described, and we're really excited to start talking to you about this today and to hear some of your feedback. So if we can move on to the next slide, please. So what we'll cover today is we'll do a bit of a whistle-stop tour, and we'll talk through how we've developed the strategy and its scope, the 5 core areas of focus and the guiding principles that we're proposing that we will adopt in all of our work. Most importantly, we need to know how successful this strategy is in 3 years' time, and what does that look like to our partners, and what does that look like to NICE. And then I'm really delighted that Carol and Deanne will be joining us and talking through some of their views on the importance of our development of a strategy and some of the work that they've been doing to support us in its development. We'll then whiz on to talk about how to have your say and the next steps, and then we'll have plenty of time for questions. And just to say again, as Sam has already outlined, we have up to 400 people joining us today. We won't be able to get through everything, but we will do our best. Just in terms of time, we know that everybody's time is precious. We've booked out an hour and a half. We are working to be done by 2:15 today. at the latest. And obviously, we will be able to kind of feedback on any questions that we haven't been able to answer. Okay, so next slide, please. So this is really exciting, like I say. I joined NICE just over 12 months ago and completely overwhelmed by the brilliant work that our people and communities do alongside us at NICE. And really, how do we really focus on the expertise and experiences that people and communities that we serve, and how do we bring that work into NICE and work alongside so that we're really making sure that we're bringing the right recommendations to the healthcare system to get the best care to people fast. And so really, as part of our transformation, we needed to understand what we were doing really well, and what our partners and stakeholders felt actually we could be moving forward with. And therefore, we commissioned an independent review about 9 months ago, and we were delighted that Dr. Charlotte Augst, who was the former chief exec of National Voices, did that work for us. Now, I'll talk you through in a minute about some of the people that we talked with and some of the focus groups, and how we've kind of come up with the strategy that we have. So very much this work is about continuing the brilliant work and impactful engagement that we do alongside people to date. How do we build upon that work? But actually, how are we more curious about what matters most to people and communities, and how do we kind of bring that into our work in different ways so that we've got more impactful involvement and engagement in our work with NICE to make sure that we are really focusing on what matters most to people and communities. So next slide for me, please. So this is very much a strategy for the future. It outlines our ongoing commitment to build upon the passion that we have always committed to involve people and communities in our work across our organisation. But it describes how we will improve the way that we capture the collective wisdom and experiences of people and communities that we serve, so that we're really thinking how we involve and engage with people and communities in our work so that our guidance is really relevant and impactful. And what we mean by impactful is it's that translation through into uptake in the health and care system. Because otherwise, if we are really, building on the work that we've done to date to make sure that we're hearing from the right people in the right way at the right time, if that doesn't translate through into uptake of our guidance by the health and care system, then actually we are missing a real kind of link. So that's what you'll hear a really strong theme about in the strategy and our work going forward. So the strategy really underpins our commitment about how we ensure people and communities feel safe and empowered to work with us in partnership to impact and influence our guidance. So whether that's through shaping where we prioritise right the way through to the development and hearing what matters most to people and communities, through to working with partners to amplify that uptake of our guidance, so that we're pulling that through into practice and we're getting the best care to people and giving people access to that health and care that we have deemed is absolutely things that matter most to people. And on the back of the strategy, which will be for the next 3 years, it will define where we will focus annually and how we will work with partners, stakeholders, and staff to amplify the reach of that strategy. So next slide for me, please. So please bear with me a little bit today. I'm just on the cusp of losing my voice, so I have the able team around to jump in if it goes, but fingers crossed. So, NICE could never develop a strategy by itself. And on the back of the independent review that I talked about before, we've really focused on how do we actively listen and engage with the people, communities and stakeholders that we work with, both internally within NICE and across the wider health and care system and across the involvement and engagement community, to really understand and test and validate some of those findings that came out of that review. And really, if we were to focus on what matters most and to make sure that our guidance was impactful, where was it that we really needed to put a stronger focus over the next 3 years? So, a real collaborative effort, over 30 interviews as part of that initial review. We then had an extensive surgery survey with our NICE expert patient panel and the Voluntary Community Sector Forum, NICE committee members, to understand actually what's working well and where could we together move forward. We've run a series of dedicated focus groups, both with staff internally at NICE and with the voluntary and community sector and expert patient groups, just to really start to test some of that initial thinking that had come out of our kind of initial draft. And then we are delighted that Carol and Deanne, who are with us today, have put some, really, really appreciated time into working through initial drafts to kind of validate that, make sure that we are talking in accessible language, and that we are really making sure that we're reflecting what matters most and where we need to head together. So what you'll hear a little bit later is Carol and Deanne's thoughts on the draft strategy so far. So if we move on, please. So getting the language right is really, really important. And we know that the words that we use can exclude certain groups, individuals, communities. And that's something that we are really endeavouring under kind of best practice in the involvement and community sector, and equally hearing from the partners that we work with, what's the language that we need to be adopting. And we know that we don't always get it right, but we commit to continue to test and learn with the people, communities, and partners that we're working with, so that we evolve that terminology throughout all of our engagement. So what you will hear is a real move from public involvement, which is what we've kind of been kind of talking about to date at NICE, moving away from patient, public, people, and community in the kind of holistic kind of way. So what you will hear throughout the strategy and our work going forward is that we'll be talking about people and communities and involvement and engagement, because engagement is, has such a specific terminology and even kind of understanding within this community. But it's how do we kind of make sure we're thinking about engagement in its broadest terms as well, working with partners to amplify the impact of NICE guidance equally. So what you will hear throughout the strategy and our work beyond is that we're talking about working alongside people and communities, and we're talking about involvement and engagement in the work that we do at NICE. Okay, next slide for me, please. So trying to pull together a strategy which hangs off our NICE strategy, our transformation plan, is always tricky. And we wanted to make sure that it was accessible as possible, as simple as possible, and so that we could absolutely pull back to our overarching vision and plans at NICE. But it was really clear of where were we trying to head, what was our vision, what were those 5 key areas that we were going to focus on, and actually what was our commitment to you and the people and communities and stakeholders that we work with, in terms of the guiding principles of how we work together. Very much kind of reflecting what we heard, what was working well, what didn't work quite so well at the moment, that we had to pay due attention to in all of that work. So what I'll talk to you about now is those kind of 3 areas and how we think that they hang off each other. Okay, so next slide for me, please. So our vision. For people and communities involvement and engagement is to have a best practice approach to involvement and engagement, improving the impact of our guidance and ensuring the best care for people and communities. So why these words? And my goodness, we have gone round and round and moved words and kind of listened and thought, gosh, how do we hang all of this together so that it really is, it resonates with people? And There were two themes really as we were developing the strategy that came out. And the first was about, how did we build upon the best practice approach that that we've developed at NICE in partnership with others, but that actually, we need to be agile, we need to be innovative, we need to be brave, proportionate, but ultimately we need to be impactful in the way that we adopt that best practice approach so that we're hearing from the right people in the right ways at the right time and making sure that we honor that voice and pulling that into the work that we do because it is all about impact. And I guess what you will see in this strategy is an extended remit, really, I guess, from the work that we've probably been talking about to date. And that's great. We can have best practice involvement and engagement, but unless that translates through into impact and uptake of the guidance and making sure that the people and communities that we work alongside can access that care, then we've got a real disconnect. So the other theme was really about impact and actually how do we work together to make sure that we have uptake of that guidance. And ultimately, it's about improving the uptake in those areas where we know will have real maximum impact for people and communities. But also, we have to be focusing on how do we reduce health inequalities so that we are understanding where our guidance has a real potential for transforming health inequalities and together working with those communities in partnership to understand how do we amplify the impact of NICE guidance and together contribute to that reduction. So that's really where our vision came from. So next slide for me, please. So we then settled on 5 core areas of focus and I guess as Sam said to you before, we will share the full slide set with you, which has got a lot more information and the Word document, which is more accessible. And you can understand and read in your own time about what we mean by these 5 different areas of focus, because all you're seeing at the moment is 5 kind of snippets. So really, let me kind of whiz through these 5 for you and try and describe what we mean in those 5 core areas of focus. So number 1, impactful involvement and engagement. So this is really acknowledging that there isn't a one size fits all. How do we really evolve the work that we've done to make sure within our guidance development process, we involve the right people at the right time in the right way? And that ultimately we're pulling in meaningful, appropriate, and targeted approaches to involvement and engagement on a case by case basis. We know that in some ways, the kind of standard committee approach is really challenging to make sure that we're really hearing those voices and pulling it in. And sometimes we don't always kind of take a proportionate approach. And therefore, how do we work with people and communities to develop a menu of approaches so that together we're involving and hearing that voice in the right way at the right time? So that's the real kind of focus of impactful involvement and engagement. Tailored approaches is a greater focus on the way that we engage with people and communities at NICE in the round. So almost outside of that kind of committee, that guidance development process. So how do we restrict some of those barriers for engagement with NICE, and how do we take that tailored approach where we can hear from people, from communities who often we really struggle to hear from? How do we seek out more diverse experiences from people from wider communities? And how do we listen, learn, and honour what we hear? And how do we use and reuse that? So that's what we mean by tailored approaches. An innovative culture, and this kind of pulls back to our best practice approach that we are describing in our vision. So, but how do we test with and learn from new and innovative ways to work alongside people and communities? So how do we do that being brave together, but in ways that make people feel safe to kind of think about how do we hear those voices. Being brave and psychologically safe is really, really important as part of this. But how do we really understand nationally, internationally, how are other people doing this, and how are we making sure that we are docking that involvement and engagement in the best way possible. So that's very much about that innovative culture, testing and learning. Number 4, productive partnerships. So we know that our reach quite often is nowhere near as far as our voluntary and community sector, our patient associations, the partners that we can work with to make sure that when we have guidance that's in place, how do we really work in partnership to amplify the impact of that guidance? Now, we know equally that sometimes we have to make recommendations that are really difficult. And actually, how do we make sure that we've got really good, productive partnerships, that we're working in a transparent, open way with our partners to make sure that we're having the right conversations, but ultimately making sure that people understand decisions, and where we can and we have that opportunity, amplifying the impact and uptake of that guidance. And our 5th is probably more internal, and this is what we kind of heard really strongly through all of the feedback, is how do we as an organisation within NICE embed an ethos and a curiosity for involvement and engagement. One of our values is focusing on our users first, and we've kind of done a slight kind of take on that. So this is absolutely focusing on people first. And getting that culture embedded within NICE and across NICE, and getting people's kind of initial thinking really will help us transform all of those other approaches that we have suggested in number 1 to 4. But actually, how do we champion that curiosity for seeking out that voice and making sure that we're really working through what matters most to people and communities, and understand the importance of where our work has had impact. And that is absolutely led and championed by the executive team. Sam and I are here today, but absolutely this is about how do we embed that culture across NICE. Okay, so next slide for me, please. So there's a lot on here, and I will kind of leave it up for you to kind of read along with me. But what we heard really clearly as part of the work, as part of that strategy development, were a number of themes. So I'm going to just kind of pick out a few of these, if that's okay. And this is really what we want us collectively to hold each other to account on, so that ultimately, when we as an organisation take an approach around involvement and engagement with people and communities, we're doing it in ways that actually are that we all feel comfortable with. And that's for staff internally, but equally for all of the partners and stakeholders that we work with. So really focusing and making sure that our work is not just formulaic and paternalistic, that it is impactful, appropriate and targeted on a case-by-case basis. We're working collaboratively with partners and a real commitment to that. There are times where we will have to have difficult conversations, and there is places where we can and we cannot act, but we will be clear, open and honest about that. Psychological safety came up through a number of different kind of conversations. And what we mean by that, and we thought we'll not use that word, we will debunk it. And we will commit to helping everyone feel safe to speak up, to disagree openly and constructively, how to test new approaches and learn from them together. We've also heard very, very clearly that we need to have a fair and transparent payment and remuneration policy to support our involvement and engagement activity. And I'm delighted to say that we hope to have that in place really very, very early on in the new financial year from April 2024. So we have listened loud and clear and absolutely worked with other arm's length bodies to understand best practice in that space. So I promise you, we are hearing and we are actively listening and pulling that into our work. We've touched upon terminology and we'll continue to evolve that. We need to more effectively and consistently listen. We use and reuse the insight and honour that information and insight that people and communities give us. We are not great at the moment at docking that information and going back and using that and validating that. We start from scratch, and that is a real kind of underpinning of our way forward. So, I mean, this is the understatement, really. Engagement is valued by NICE and has visible commitment from the board and the executive team. It seems a shame that we even have to put that on, but absolutely that is a statement that we are absolutely committed to. Evidence informed and aligned with best practice. And then moving through, we need to be innovative and remove barriers that alienate or discourage involvement, especially from traditionally marginalised, excluded or underrepresented groups. And how do we build that trust? Not easy, but something that absolutely we are committed to. The next is really around that, making sure that we are have that culture of curiosity. So how do we embed that across NICE so that we're making sure that people are thinking about the impact of people and community involvement in all of our work. And then last but absolutely not least, about how do we work together? How do we be brave to try new ways of working? We learn and adapt together, but ultimately we value people's diverse skills. So moving on for me, please. So going to just quickly whiz through the rest of the slides, if that's okay. And like I say, you'll be able to look at these in due course in your own time, and we'll give you some information about how you kind of feedback. So this is a long game. This is over the next 3 years. We will know that our strategy has been successful and that we have been able to deliver our vision if we measure, monitor and share progress with all of the people that we work with on how we are kind of working towards that together. So any good strategy sets out its vision, but also says, how will we know that we are making progress? So what you'll see on the next couple of slides is measures of success that we have proposed and that we will set annual targets that we will validate with our partners to make sure that actually they are realistic, but they are stretched year on year, and that we will test that we're on track by seeking feedback from the people that we engage with. Okay, next slide for me, please, Mark. So in terms of measures of success, and what you will see in the kind of final strategy is all of this on one page, and what we've tried to do is pull it out so it's a little bit clearer. So what we are committing to, so in terms of those 5 areas of success, so in terms of impactful involvement in engagement, what we are committing to is improved uptaking guidance measures. So what we're saying there is in our quality standards, in our medicines, so in defined areas, so we can't do it in everything, but working with people and communities and our steering groups to pick a handful of areas where we can say, actually, we would expect to see uptake in those areas. And equally, we'll be tracking the impact of specific areas where we know are impacted by health inequalities, and that actually we are starting to change the dial in some of those areas. We already ask for feedback from people exiting our committees, but actually we will expand that in terms of people's experience and the impact that they feel from those that are involved in guidance development. So really will evolve and transform our kind of approach to capturing feedback for those that we work with. I've already touched on this, and our transparent that we will have a involvement and engagement activity is underpinned by a fair and transparent payment remuneration policy. And this for us is a really quick win, and we aim to have that in place by the first quarter of 2024. Okay, No, next slide, please. In terms of tailored approaches, so this is really about how do we engage in different ways. We have a reputational research survey, which we do at NICE on an annual basis, and we target different sectors. And so what we expect to see, certainly in terms of that kind of partnership approach, is annual improvements in that survey from the voluntary and community sector across all of the domains that we measure. And that because we want to engage, we want to hear from groups that are traditionally marginalised or underrepresented, and that's absolutely including carers, advocates, or representatives. We will monitor how we're seeing increased participation from those groups. Next slide for me, Mark, please. Okay. In terms of an innovative culture, so we are transforming everything that we do at NICE, and as we work through our new approach to prioritisation, all new guidance from this year, we will adopt a tailored approach to achieve impactful involvement and engagement. So that we will work out what is the right approach from that kind of proposed menu for all new prioritised guidance from 24-25. And then in terms of any updates to guidance development methods, so really the Bible, as it were, that tells us how, or the manual that tells us how to deliver our guidance production, we will specifically define tailored options for impactful involvement engagement within that methods manual. Okay, next slide for me. Productive partnerships, we've already touched on. So we make a commitment this year that we will formalise partnerships with defined voluntary and community sector organisations to increase the uptake and impact of NICE guidance. So very much centering around what's coming through this year, or where we know there's been specific challenges in terms of uptake of guidance that's already in place. Okay, next slide for me, please. And last but not least, our commitment over the next 3 years is that the board will have a designated non-executive director with specific responsibility for people and community involvement and engagement, something that the chair and the chief exec and executive team are committed to. And also this year we will be rolling out a new scheme of involvement and engagement champions across NICE. So this is truly embedded. Plus we have a real focus on champions. Okay, next slide for me, Mark, please. So how will you know that this feels any different? Yes, we can kind of look at all of those measures, but how will it feel different? You know, how will people and communities who are working alongside us know that the strategy is working with them? So yes, we will measure, but what we aim to see, you know, over the next 3 years is that people report that they can clearly see the influence and impact of their insight in our guidance, that their insight has been sought, actively sought and valued, that they feel that they're working in partnership with NICE and they're co-producing work to amplify impact, that we see improved uptake of guidance in areas most affected by health inequalities. They have a brilliant and a positive experience of working with NICE, and we hope to build upon that to date. But that actually we work alongside in a way that works for people and communities instead of trying to engineer and bolt into a way that perhaps has felt disproportionate or hasn't felt appropriate for the work that they were doing at the time, and feeling actively involved in testing with and learning from new approaches. Okay, so just kind of wrapping up now, really. Next slide for me, please. So what next? So Mark will talk us through in a minute about the consultation and how you can feed back. But what we will do over the kind of the coming weeks and months is translate that strategy into specific annual deliverables, targets and activity that can be taken forward in partnership with the people, communities and partners we work alongside. I'm sure all of you are looking now going, gosh, well, hopefully you're all looking at it now going, oh, this looks great, but what does it actually mean? And that really is the next step on from the overarching strategy of the description of how do we all kind of pull it together, and what are those activities year on year that ultimately will help us deliver our aims and ultimately that vision. So people and community involvement engagement activity will be spotlighted through our programme board reporting, our internal reporting at NICE, and reporting measures up to the board on a regular basis. We'll also commit to having an annual review of engagement and involvement activity, which will report into the board and also be feeding into the NICE annual report. So lots of opportunity for our steering groups to be overseeing the work that we're doing, making sure that we're on track and delivering our aims, but an absolute board commitment to this agenda and making it visible. Okay, so next slide for me, please. So I am delighted now to introduce Deanne and Carol. They will just say a little bit about themselves, but both expert panel steering group members have been involved in a lot of our committees, brilliant, brilliant partners of NICE, and we're incredibly grateful that they have been testing and validating some of our work to date. And so I just would like them to come on camera if that's all right, and just say a few words about their initial thinking. Thank you.
Hi, thank you, Claire. That's a great introduction. Yeah, both of us are going to be speaking to you this afternoon. So good afternoon, everybody. I'm Deanne Davis, and Carol will be introducing herself shortly. Right. I'm speaking as someone with lived experience of long-term conditions and experience as a carer for my family members with complex medical conditions and disabilities. And Carol and I, we both have several years working alongside NICE as what NICE calls lay members, and we're members of the NICE expert panel. And for those of you who don't know, these are individuals with lived experience and insight who want to help with the work of NICE. And there are at the moment over 300 of these expert panel members. We've both been lay members of the expert panel steering group, as Claire just said, for the last 3 years. And that steering group does what it says on the tin. It steers the work of the expert panel. And we've both had years of experience listening to people living with health conditions and disabilities and people working in the organisations that support them, hearing about what really matters to them. We both contributed to the development of this draft strategy, as Claire said. And initially, as members of the NICE expert panel steering group, we were two of the many people who were interviewed by Charlotte Augst to offer our perspectives and insight as part of that independent review last year. And that listening exercise was crucial to the development of this draft strategy. So Carol and I, we're addressing two questions. I'm going to take the first and Carol is going to take the second. And the first one is, why is it important to involve and engage people and communities in the work of NICE? And my answer to that is, in short, it's the right thing to do. It's as simple as that. And it will reap rewards for NICE, but more importantly, for people living with health conditions and disabilities. But it has to be done in the right way with genuine commitment at all levels of the organisation. So I joined NICE because I had perspectives, experiences, and insight that I wanted to share, that I felt I could help improve health and well-being for a large number of people. Now, I've learned over the years that it's not as simple as that in NICE, and there's a way to go to make that achievable. But this draft strategy is definitely a start and is building on some of the good work that's already been started. My view is that people want to know that they're providing relevant insight, perspectives, and reality checks for NICE. People and communities from diverse backgrounds and seldom heard groups want to know they're engaged because of their essential insight into real lives and not as a tick in a box. People, communities, and the amazing voluntary and community organisations who support them want to be properly supported when providing their insight. For instance, things like minimising challenging paperwork and offering appropriate financial reward. People want NICE to work smarter. They want them to gather, use, and reuse relevant insights so people aren't constantly frustrated by repeating themselves over and over. And they want to experience co-design, co-production, and co-reviewing principles as everyday business as usual, not as something exceptional. They want to be confident that NICE understands how health inequalities impact on their real people's lives and want NICE to act on their suggestions and ideas because they're the people who know what does and doesn't work for them. And people need more flexible and creative ways of offering their insights and not just by attending meetings. People want NICE to be genuinely interested and curious about what matters to them and what will improve their lives and actually what won't. And people want to know how they've had an impact and how they've influenced NICE guidance. So if people experience all of these things, then more people, communities, and the organisations that support them will feel that their time and their contributions and insight are sought, valued, and acted upon. They'll see NICE as a trusted partner that proactively seeks out views and experiences of people whose voices are not often heard and who experience health inequalities. They'll feel much more confident in initiating topics for consideration and describing unmet needs and being an equal partner in their own shared decision making with professionals. They'll see more people engaged in NICE's work who may look like them, have similar life experiences, perspectives, and backgrounds, and therefore feel much more inclined to support that work. They'll want to engage with, initiate, and stick with ongoing partnership, co-design, and co-production work. And they'll develop new sorts of longer lasting sustainable relationships with NICE that can be shaped by and suit people and communities rather than the other way around. And they'll benefit from more sustainable guidance because the right people have been involved from the start. They'll feel safe and supported enough to be able to challenge professionals' views when appropriate and influence decision making through their insight. And they'll see NICE as a listening and learning organisation, curious to learn more about the people who'll be affected by or will benefit from the guidance. So ultimately, this level of confidence and trust will increase the credibility of NICE guidance in the eyes of people and communities. So, like NICE, I have a vision too. And that is where, in the not too distant future, all of NICE's guidance is shaped and influenced by the people and communities who need to be engaged to make that guidance the best it can possibly be. That these people are happy about the way they're working in partnership and they feel proud of the improvements in health and well-being resulting from their engagement. That people like me won't be speaking about the benefits of engagement. Instead, a diverse range of people, including the organisations who support them, can use a variety of creative ways to show the world how they're engaged and involved, how they're influencing NICE's work, and the benefits of that work for other people and communities. So finally, if you, everybody who's watching this, if you have a vision too, or if any of this resonates, do please make sure you comment on the draft strategy to make it the best it can possibly be. And with that, I'm going to hand you over to Carol for a slightly different question.
Thanks, Diane.
Sorry, Carol, just before you start, I think somebody's asked Mark if you don't mind taking down the slides so people can actually see Carol and Deanne and they aren't just little, great, thank you. Sorry, Carol, over to you.
Apologies, I lost my buttons there.
We can see and hear you now, Carol.
Perfect. Thank you. Thanks very much, Claire. Thanks, Deanne. Good afternoon. As Deanne mentioned, I'm Carol Pitt-Keithley, and like Deanne, I bring a range of experiences to my varied roles as a lay member with NICE and as a patient and public voice partner within the NHS, usually at a more strategic level. And there's a little thing there to think about already, isn't it? That depending on which organisation I work with, I'm called something different. So for me, that's the first thing NICE needs to get its head around. I'm a former director in the civil service, and I've represented service users across a range of sectors my entire career. And I think, you know, that done well, there are some real impacts of engagement and involvement on the wider health and care system that NICE really needs to take into consideration. And for me, it's all about shaping a sustainable future that meets everybody's needs and aspirations. We've just heard that there are strong moral and ethical reasons for ensuring that people and communities' voices are heard. But of course, we all have a right to have a say over the public services we pay for. But there can be real impacts on health and care services by doing that. Services will be more effective, they'll be more efficient, and they'll be safer if people and community voices are central to the way that they are designed, monitored, and evaluated. And I wish I had a pound, you know, for every time I've seen services designed in-house, as we say, with little or no input from users. Then the architects of those services sit around scratching their heads, wondering why they don't have the desired impact. So what are these impacts on the health and care system then? I think key is the improvement of financial sustainability and enabling the efficient allocation of resources. By understanding what matters to people as well as what is the matter with them, we can understand more about population needs and preferences and use this knowledge to develop guidance and services that are more responsive and enable the efficient prioritisation of resources to where there is greatest need and that can have the greatest impact. And using insight and knowledge of the needs of people and communities, we can better understand and break down barriers to access, all of which I think will improve financial sustainability, which is just so important in today's economic climate. Another really important impact on the health and care system is the creation of better population health and well-being by reducing health inequalities. And Claire did touch on this before. People who find themselves excluded from society, discriminated against, disadvantaged, or lacking power and control can be the least likely to access benefits, the benefits and services, despite often having the worst health. And I really don't need to tell the people watching this today the impact that that has. But engaging and better understanding the experiences, perspectives, and needs of those who regularly face the worst health inequalities impacts the development and delivery of more appropriate and accessible solutions, as well as having a direct positive impact on social cohesion and on self-esteem for those who are engaged with. And I believe that by doing that, it will encourage them to engage more. But NICE has to find ways to get to those people whose voices need to be heard, but often aren't. And there's a real potential to change lives, you know, by working together with people and communities. NICE has a real opportunity to transform the experience of people who use services, as well as the experience of those who deliver them. When people are involved, either at a personal or community level, they feel a bit more in control and so more able to make choices that work for them and so optimise their own well-being, as well as those that they represent or advocate for. Evidence shows, and NICE loves a bit of evidence, doesn't it, that those who are involved in decisions tend to report greater satisfaction, experience less regret about services they've received, and make fewer complaints than those who aren't involved in decisions or discussions. So actively engaging widely increases these benefits and so impacts the lives of the population through the quality of service provided to them. But you know, they're not just benefits to the system, there are internal benefits and impacts too. And there's a clear reputational benefit to engaging people and communities because NICE is showing that it walks the walk. And we heard Claire say before how important it is that we're going to have somebody on the board who is responsible for people and communities. For me, that should have been happening all along. I know there was someone previously did this, but it should just be part of the imperative for the board. But there are other benefits that NICE and other rewards that NICE can reap too, I think. Engaging communities contributes to openness and trust, building understanding that working together leads to better outcomes, which improves safety, experience, and performance. It provides additional quality assurance too, because learning from those who understand an issue or know how it feels to live with something provides a layer of scrutiny that you just can't achieve if you only ever look inwardly. This in turn will increase integrity, and it actually enhances the governance of an organisation. And of course, it reduces the chance of legal challenges, as those who might have something to say are already involved or represented in the conversation. But a really, really great benefit for me, and Deanne touched on this a little bit earlier, is that by engaging NICE, you can actually get others to do some of your job for you. By building robust and trusted partnerships and relationships, working across groups, areas, and boundaries all helps to break down barriers. You'll be able to reach more sections of the population, including those whose voices are just not heard enough. Amplifying voices also encourages people and communities to continue to engage with you and offer their experience, their expertise, and their insight, which in turn will contribute to guidance that will be appropriate and will be sustainable. But I think what it also does, and I've seen this in other sectors that I've worked, is that it encourages those you engage with to signpost and encourage others to use your product. So in this case, guidance, and then to engage with NICE because of the benefits that it's brought to them. So finally, from me, I guess involving people and communities is an organisation-wide and even a system-wide imperative. Because as Deanne explained, it's just the right thing to do. So I think the question NICE must always ask itself is not just what are the impacts of engagement and involvement, but why would we not always want to do it? And that's really up for me, Claire, thanks.
Great. Thank you so much, both. I think, Mark, it's over to you now to just explain next steps, and then we will go to the Q&A. Lots of people have been posting at that.
Yes, that's quite a hard one to follow. Thank you, Deanne and Carol. I really agree with everything you said there, and hopefully the aim of this strategy is to achieve all those things. So I'm Mark Rasburn. I'm one of the senior public involvement advisors here at NICE, and I'm just here to talk about the next steps and some information about the consultation. So the public consultation has officially started today, and it's open for around 5 weeks. So it closes on the 27th of March. And as Claire said earlier on, it's really important that we get this right. So we'd really encourage you to share your views to ensure we get this as right as we can do. So the 4 questions you can see on this slide are the main areas we'd like to hear your views about as part of this consultation. But when you're reading through the strategy, always be considering, will this enable NICE to achieve best practice approach to involvement and engagement? And in the 5 core areas we've identified, do you think these are the right areas for NICE to be focusing on? Do you agree with the 12 principles we've identified, and will they support us to achieve these aims, or are there any missing or not quite right? We've also drafted some areas to measure success, as Claire went through earlier. So again, do these feel right? And can you think of any others that we may want to include in the final strategy? Oh, skip too fast. So I think this slide is probably the most important one in the presentation, as it tells you where to find everything. So earlier today, we emailed a direct link to the consultation to most of our contacts on our contact list. We'll also share these slides and the recording on everyone who is attending this webinar. So you will have a direct link to this if you're here today. The consultation page itself is where you'll be able to find all the information. So it's where you can find our draft strategy, It has information about the consultation process, and there's a link to the consultation survey in there. It'll also have some information about a couple of drop-in sessions which we'll be running. And these are designed to help you further with any information that you may need. So to ensure that you're able to share your views. So if you have any questions or help to navigate the consultation information, please do come along. Or alternatively, we have our dedicated email address, so you can send any questions that you have to there, and the team in the Public Involvement Programme will happily pick those up. So as mentioned, the consultation closes on the 27th of March. We then have a couple of weeks to analyse the responses we get and update the strategy where necessary, ready for it to be presented to the NICE board on the 15th of May. We'll then publish the strategy and outline how we're going to be taking it forward and how we'll be working together. So we'll have our signed off strategy and it will be published on the website. But then the next steps are how do we actually translate this into specific deliverables and activities? So we'll be working with our partners, so our people and community involvement and engagement groups, to identify and agree what we need to do as an organisation to enable us to have that best practice approach to involvement and engagement, which will ultimately improve the impact of our guidance, but also ensure that the best care for people and communities is available. So this is the last slide, and I think we're going to hand over to do some questions and answers. So I'll stop sharing now so we can see everyone. And I can see quite a few questions have come through, haven't they, Sam?
Yeah, thank you so much, Mark. I'm going to be Compare, and Mark and Laura and Claire and Heidi are going to answer the questions. So there've been a couple on measures of success. When is it going to be published? What do we mean? How is this reflected in the NICE management structure? I know those have largely been covered in the presentation or in the chat, so I'm going to take those as adequately answered. Please add more kind of flavour into the Q&A if you don't feel that they have been. So then maybe let's go straight on to, there were a group of questions around, are you going to share the independent report? What did it find? What are the weaknesses? Or was it not working well? Claire, is that for you?
Yeah, I'll take that. And yeah, we've already shared that with our steering groups. And so yeah, absolutely, we can put that summary and share that with anybody who wishes for more information. So what was working, I think in terms of what was working well, people felt that we had the commitment, absolute commitment at NICE to involving people in committee structures. But it felt very much, I think, consistent feedback. It felt quite paternalistic, our approach, quite formulaic, and that we very often heard from people, perhaps not always the right people in the right way. And then we didn't reuse that information. So quite often we would be developing, doing a health technology appraisal for a medicine. We would be asking for information and it would be in a specific disease area or topic, and then we'd be doing guidelines alongside, and we would be going out and asking the same conversation and having the same conversation again. So it was that absolute, the strongest theme, I think, was that absolute commitment to active listening, honouring that feedback and transferring that through. And really taking a proportionate, pragmatic and tailored approach to our involvement was the key theme. I think in terms of engagement, and I think somebody has put this in the chat, when we talk about involvement and engagement, what do we mean? So we have always talked about public involvement at NICE, and that has been very much, and this came out strongly in the review, about public involvement within our committee process and our guideline process. And what we mean by engagement is that broader relationship. It's that end to end, right the way through from prioritisation of that guidance, right the way through to once that guideline or that technology appraisal has gone out into the wilds of the health and care system. How do we make sure that we are continuing to engage with the partners who can really amplify the impact? So we're taking a kind of a broadest sense of approach to involvement and engagement. So those were the two greatest themes, I think.
Thanks so much. Thanks, Claire. And I think there's a little follow-up one from Angela Quilter, who is an old and dear friend of NICE, who said, aims are all great. What precisely are you going to do? Can you be more specific? So when will people get the specifics?
Yeah, so I'm going to hand over to Mark and Laura to talk that through, because you're absolutely right. Trying to balance off a strategy that will still be good to go for 3 years versus the detail of what we're going to do is tricky, and everybody knows. So what we're going to do this year. So Laura, I don't know whether you want to kind of introduce some of the specifics, and I think a focus around that kind of tailored and impactful engagement would be really great.
Yep, so Laura Norburn, Senior Operations Manager in the Public Involvement Programme at NICE. Yeah, it's a great question. Obviously, with the strategy, we've kept it quite high level. We do have metrics such as we have our regular surveys with people about their experiences, so we can benchmark where we are at the moment. But part of this approach, we will need to work with our steering groups and our people in communities to help us shape some of those outcomes. So we could sit, in a darkened room and come up with a few. But I think really as part of this approach, we're starting this 3-year journey, and we'll need to work with people along that journey to define some of those outcomes. So we have certain things, as Claire, you talked about earlier, being able to benchmark against quality standard uptake. So we have certain uptake measures we can use, we can benchmark them, and then we can look year on year about how we want to improve. And then others, we need to work out what matters most to people who are working with us, and then we can start to benchmark that and see where we're improving as well. And those tailored approaches will involve a bit of test and learn. So it might be, we have to think about what we can prioritize within those 3 years, year 1, year 2, year 3, test and learn in a few areas, do the evaluation, see how well it's gone, and then work again to say, okay, maybe that bit didn't work, let's build in another area and keep iterating as we go along. I think what we don't want to do is nail everything together and say, this is exactly what we're going to do for 3 years. We need to work collaboratively to do that. So yeah, some things will be pretty easy. Reputation research we've got, questionnaire surveys we've got, other things we need to work together, I think, to identify some of those things. So ideas in consultation, again, what would you want to see? Thinking about our strategy and our approach, where would you see the impact?
Great. Thank you so much, Laura. So just to summarize, this document needs to stand the test of time for 3 years. Detailed action plans tend not to. The things you can expect next year are publication of the strategy, clarity on the measures of success, or as Bren would like them to be called, measures of impact. We'll revise our remuneration policy, and we're going to test and learn some new approaches to involvement and engagement. So then there are next group of questions, and I don't know who this is for, is there was a bunch of questions around who have we spoken to so far? So specific communities that were called out were children and young people, Gypsy, Roma and traveller communities, and then who do we know that we've not spoken to, but it's kind of on our to-do list?
Yeah, it's really tricky. And I think just to kind of flag, today is the start of consultation. And this is the opportunity for us to test with some of the communities that we perhaps haven't had a chance to do so yet. So we have worked really closely with our voluntary and community sector steering group and that wider kind of forum that we have. We have hundreds of members. And so certainly as we've kind of done some of those initial kind of thinking, to get to all of those communities is really challenging. So we've kind of tried to cover that off really through our work with our voluntary and community sector forum and members, and equally through our expert patient forum. And we've had some initial conversations. So this is the start of consultation. And so, we'd be really grateful if you want to kind of take it away, if you kind of represent communities, if you want to kind of test that, or you instantly see some things that we've put in there that you think, God, the language isn't quite right. And actually we need to kind of test something very specific with certain kind of communities or groups. I think it kind of comes back to the devil is in the detail, as we talked about before. So we talked about how do we make sure that we are engaging with communities that are seldom heard? How do we kind of work in different ways? And I think, you know, some of the community, some of the groups that I think Bren and others have kind of pulled out is really how do we take that tailored approach? We know that we've got some guidance that will be coming through next year, or we've got guidance that has got really poor uptake that is impacting upon those communities. So it will be taking that tailored approach with those communities and with those patient associations of actually how do we work differently and how do we get that voice to really impact on improving uptake, but also as part of that guidance development. And I think just kind of pulling out, John has said about calling lay members, absolutely, and that's exactly why we put that slide in about language matters. We could have just bulldozed in and said, we're not going to use this anymore. But what we wanted to do was to kind of work through with our groups that we work with and actually work out the language that you want us to use when we work alongside you. So yes, just to call out that question as well, Sam.
Great. So there's a couple. I'm going to make a suggestion because we're going to struggle to get through everything. Either Mark or Laura, can you answer some of the specific questions on remuneration that are in the Q&A? Because that's quite simple and we can just kind of do that via chat. Then Martin and Peter have asked some questions about multimorbidity. They've made this great point, which is that NICE guidelines are condition specific and they don't address the majority of people who may have multiple long-term conditions. What are we going to do about that? So I'm just going to quickly say, yes, we know that's an issue. We've been taking a look at it with our Chief Medical Officer and Clinical Guidelines group this year. It's not really clear what the answer is because a lot of the research doesn't provide evidence for people with multiple long-term conditions. So this is something that we're having a bit of a discussion with NIHR about, a bit of a discussion with the Chief Medical Officer. We know more needs to be done. We're not exactly sure it is. Sorry, Peter and John, if you've got better, if you've got kind of an example of what you would like from us, that would be gratefully received in the chat. So now going on to the next group of questions, which is around one of your slides says you're going to improve uptake in guidance measurement for things that matter most to people and communities. How are you going to identify what that is?
Sorry. Yeah, just sorry, trying to get off mute there. So we obviously will be working within the confines, as it were, of what NICE is prioritising in terms of its guidance that will be kind of coming through. And for those of you who joined the webinar last week, where we consulted on our new prioritisation framework, we will produce a forward plan which describes the guidance that we will be producing for the coming year. So in terms of within the process, we need to be thinking about that impactful engagement and that menu of approaches that we will take for the new guidance or the updated guidance that will be coming through this year. And working with our steering groups to be able to kind of test and learn that, and then convening specific kind of groups and test and learn groups to make sure that as we're starting off with that kind of approach that it feels right and that we're really listening to what matters most. Then in terms of, I think there was a specific question about, we said that we would look at uptake in terms of what matters most to people and communities. A massive kind of challenge that we have because in terms of measuring all of our uptake, it's a real kind of step change that we've taken this year at NICE in actually even measuring and understanding what our uptake is, so that we can work with partners to really be able to amplify the impact and really to be working on the ground to understand where uptake is not where it is expected and actually in where it could be generating even worse health inequalities. So what we will be doing over the next kind of 3 to 6 months is working with our steering groups, and we'll be kind of pulling in and we'll kind of test and validate where are those kind of specific areas that we can really we know that there is really poor uptake or health inequalities. And if we're looking at some of those quality standards that really have been driven by the people and communities that have been involved in some of our previous guidance development, that they just don't feel is really kind of getting traction in the health and care system. So that's all to kind of play for, I guess, Sam. But I guess it's about managing expectations. It won't be everything, but it's actually how do we take a step in understanding that for the first time this year, but really kind of steered by our communities.
Could I just add on to that quickly? I think it's quite important to think of this strategy as kind of a nice wide, all the way from identifying topics, prioritizing them, developing the recommendations, all the way through to implementation. So in terms of that, meeting the need, it's understanding what that unmet need is and having that flexible approach to enable us to identify those current issues in the system, where the gaps are, what's working well, which we want to amplify. So when we select topics, we've had that level of involvement and engagement all the way through to publication. So we're continuously thinking about what does this mean for individuals who are using services. So it's all the way across NICE, not just through decision-making committees.
Great. Thank you so much, Claire and Mark. I sense that Claire's voice needs a little rest, so I'm going to take a couple of questions from Madeline has put a couple of questions in the chat, which are really around NICE's broader medicines policy. So there's questions like, isn't it inequitable if Scotland gets access, not England? Who agreed the severity modifier rather than end of life? Our quality threshold hasn't increased for a while. There's an issue with combination therapy. So I won't get into that in lots of detail because each of those could be a webinar in and of themselves. But just to remind people that our threshold is set by the department was kind of agreed every 5 years, so to speak, in the voluntary pricing and access scheme that has just been concluded and has kept the threshold as it has historically been. So that's really would have been the only mechanism to renegotiate that. And that's a 5-year agreement. So I think we can consider that settled. In terms of severity, that was part of our consultation on methods. And we are monitoring how we look at it and, how severity is applied. And we'll relook at it this year. And then in terms of inequity between Scotland and England, yes, indeed, that is what it means. But having two different HTA bodies, they will inevitably look at evidence in a slightly different way, inevitably consider uncertainty in a slightly different way. We do constantly look at what our performance is relative to Scotland, and we do not in general say no more frequently than Scotland. So we're kind of comforted that there's not any systematic inequity across all kind of our medicines appraisals. So I think I've given Claire's voice enough of a time to rest with that interlude. There's a couple of requests, which I'm just going to kind of paraphrase because they don't really require a response. So one is, are we going to use evidence-based best practice in PPIE? Yes, please. Could we get plain language support around health economics? Could we update our advocacy guidelines? I don't think those really require a response. They're kind of requests. I think the next one that will require a response is around this idea of partners. I think that's piqued a couple of people's interest, Claire. How do we identify partners? What will it mean, et cetera, et cetera. Could you say a little more about that?
Yeah, absolutely. So like I was saying before, over the next 12 months, we will have a suite of guidance that will be updated, or will be new guidance coming through. And what we will know what those topic areas are once they've kind of been prioritised as part of the forward view. So it will be about working closely with the patient associations, with the voluntary and community sector, who are working with the people and communities most impacted by those areas. And that's really what we mean by partnerships. How do we agree some joint objectives where we know that guidance is going to be tricky to implement, and that we kind of work together, whether that's producing kind of shared information together, whether it's about publicising how people can access that best practice treatment. So all to kind of play for. And I think we are already, we know what some guidelines or guidance that's coming through this year. It's going to be really tricky, really emotional, I think, for some of the patient and or people and communities that are impacted or could be impacted by some of this guidance. So we will really kind of focus initially on those formalised partnerships with some of those organisations. What we also are doing, and it did come out of the independent review, was how we completely refreshed our governance and our approach of working with the voluntary and community sector. How do we, and equally with our expert patients, how do we create steering groups and working groups underneath that really help to drive some of the work, so that it's not done too, that it's very much about ultimately thinking about the people and communities who are impacted as that kind of driver for change together, and creating some joint objectives. So that's what we're kind of working through. But initially, that will be kind of the focus of those formalised partnerships. Absolutely, in terms of working really closely with our stakeholders and wider partners, does not change, but we know we can get better.
Thank you, Claire. So I think we're coming to the end of our questions. We've got one about other guidelines, one about new types of evidence, and then one about linking with the grassroots through ICSs and ICBs. If you feel we've not answered your question and it's not one of those, please kind of put it in the Q&A. I'll answer the first of those two, which is new types of evidence and other guidelines. So the question is, will we be recognising other people's guidelines that NICE doesn't necessarily publish? So the answer to that is we are absolutely investigating it. We don't know what is feasible and what isn't. But if we are going to prioritise and keep our guidelines up to date, that will necessarily mean there are a group of conditions that we don't look at. So we're working through a case now where we've been trying to figure out, could we take what people have done internationally and reuse it? So that's one thing we're working through. The other thing which we are already doing is doing evidence reviews where we collaborate internationally, so that we are taking the same evidence reviews from other countries and we don't all have to repeat it. So that's work in progress, watch the space. New types of evidence. I mean, that is always the challenge with NICE. One thing I would say around new types of evidence is we've looked at the update of the new methods for technology appraisals and what that's meant in terms of committees. And what we have actually found is about 30% of committees' decisions allowed for some kind of flexibility due to things such as uncaptured benefits, unmet need, health inequality that couldn't be accounted for any other way. So I think it's not exactly answering your question, but I think there is an increasing kind of sense from committees that they are happy to apply flexibilities for some of these things that can't exactly be calculated in the cost effectiveness ratio. And then Peter, thank you for your multiple posts around multimorbidity. We are not in any way saying that multimorbidity is not an issue. What we are saying is we don't exactly know what to do with it right now, but we'll put our thinking caps on, and this may be something we're talking about this time next year. And then to the last question for you, Claire, I think we've rested your voice enough, it was from Julie, and she was saying, and this is a theme that is coming across from a lot of the different questions, is it's really important that we link with real grassroots folk who find kind of NICE this impenetrable behemoth. And she was saying, how do we think we're going to do that? And is there some way of working through ICSs and ICBs so that this is kind of a living approach to involvement and engagement?
Absolutely. This is core, isn't it, to impact, because ultimately if those ICBs don't commission those services based on NICE guidance, then people can't access that. So yeah, we've done quite a lot of exploratory work this year in building our relationships with integrated care boards and really understanding what it is that commissioners need in terms of being able to see very clearly our recommendations and how they then make sure that they are kind of pulling them through into their local frameworks and implementation. We know, and I think Carol described this beautifully, the environment in which NICE guidance lands is incredibly challenged from a provider, but also from the health and care system perspective in the greatest kind of sense. And therefore, we have to make sure that we are making it really easy for commissioners, practitioners, people and communities to understand what NICE is recommending. We write in plain English, and we that people then can use that to be able to kind of inform conversation. So two things really. What you will see from this year kind of moving forward is our real kind of focus on making NICE guidance as usable as possible, that we're talking in plain English, and that we are really focusing on templating our recommendations in a better way. And then in terms of working with ICBs, and I think there's absolutely work that we can kind of pull into the involvement and engagement strategy, specifically from how do we make sure that we're hearing the voice in some of the challenging conversations that we have in terms of commissioning of services. We can be saying, but it's in the NICE guidance when you're financially pressured and your practitioners are saying, yes, but we need to kind of balance this off. I think it's then how do we work in partnership to be able to make sure that those elements are understood. Somebody had also put in there about CQC. We're working really closely with CQC so that we are CQC is able to use our guidance as effectively as possible for supporting them through the single assessment framework to be able to judge what best practice looks like. And also a kind of theme that's come through the questions of how have we worked with other arm's length bodies, other organisations. We work really closely with NHR, CQC, Health Research Authority, all of the other kind of national organisations. And so we very much kind of listened to their best practice, what they're doing, and an absolute commitment to taking that forward. So a very kind of long answer, really, but ICBs are absolutely the common denominator that, across all of our work in terms of implementation and impact, because if we cannot get our guidance adopted and in, then actually that's a massive blocker. So continuing work, Sam.
Great, thank you. So just jargon buster for people asking in the chat. What are all these acronyms? CQC, Care Quality Commission, which kind of accredits providers, and ICBs, Integrated Care Boards, so they're kind of local commissioners. I think that this brings us to the end. Thank you very much to the person who said you're talking about health inequalities and involving marginalized groups, but this is hardly the world's most diverse panel. So points well made. Thank you so much. They said start as you mean to go on. Now I think we've answered, at least at a high level, most of the your questions and answers. Thank you so much for that. I think my closing thought would be, let's enter this all with kind of a can-do attitude and learning as we go. One thing I can guarantee is we are not going to meet everybody's needs all the time in a perfect way immediately, nor I think would you expect us to. So let's just constantly get challenged from you. Are we on the right track? Are we not doing things right? Are these actions specific enough? Are they not specific? So I hope that this is just the start of a lovely long conversation that we continue to have over the coming years, and really looking forward to your more detailed feedback on the consultation. I'm handing over now to Claire and Mark, who will close us out.
Lovely, thanks. Mark, do you want to just quickly whiz through then again, just how people can feed back?
Yes, you're testing my IT skills now. Okay, so as we said, the next steps, so the consultation is open now and it closes on the 25th, ready for the board meeting on the 15th of May. I'll leave this slide up so you can see some of the drop-in sessions which we have, but more importantly, the email address at the bottom. If you do have any questions or need support to participate in this consultation and the survey, please do get in touch with us and we'll be able to respond and provide the support that you do require. And then drop-in sessions, if you want to come along and speak to someone virtually, we can answer any questions there.
Thanks, Mark. So I just wanted to say thank you, and thank you to all of the people who were involved in getting us to this draft. And just to reiterate that, and I think that's a theme that's coming through from a lot of the questions of, so what next in terms of plans, and equally, I think it would be better if, or some of your kind of thoughts. This is absolutely our starter for 10. This is our start of our conversation and our consultation. So we are incredibly grateful that you've given up an hour and a half almost of your time. Famous last words, we will be done in an hour and 15 minutes. Incredibly grateful for your time. And if you do want to let us know any of your thoughts, like Mark said, we will share a copy of the strategy and some information with you directly for everybody who's signed up, so that you can take a little bit of time and read through in your leisure where there's a little bit more information. This is the start of the conversation together, and I am really encouraged by the lovely comments that have come through as part of Q&A of people feeling that we are taking a turn in direction, and this is an important signal for NICE. So you have my commitment. I am the board lead for engaging with people and communities at NICE, and so this is something that I am incredibly passionate about and championing. So if you've got any further thoughts on this, then please feel free to engage as part of the consultation. Thank you very much for your time. We look forward to working with you. Many thanks. Bye now.